This is cool.
All right, here we go.
Here we go. Hey guys, it's Jay and Monica here today on our second FabFit Over 40 local Google Hangout, and today we have Dr. Brett Osborn and Dr. Leonard Farber, who are two awesome guys and personal friends of mine. And
mine too.
And Monica's, of course. And we want to talk to them about everything as it relates to health and fitness, anti-aging, hormone replacement therapy, optimizing your hormones. I mean, really, we can talk about anything today, but I really want to delve into their expert minds as far as a lot of the stuff and how it relates. I think a lot of people out there today, unfortunately, feel that doctors, don't get the credit that a lot of them deserve from a standpoint of like really helping people with not just medicating them when they're sick and have disease and stuff like that, but to help them with their nutrition, to help them with their fitness. And both of these guys are really, not cut from the normal cloth of doctors in that they're in great shape and absolutely know just as much about fitness and health and nutrition as they do about medicine.
And they're both amazing individuals. So this is by far the best opportunity for anybody out there to have a great connection with wonderful people and with knowledgeable doctors.
Yeah, and they're both fathers. They have, each of them has multiple children, and they run very successful businesses. So we're honored and thrilled to have them on our show today. So
yeah.
With that said, I just kind of want to go down a general route. I'm going to let Scott kind of mediate here, but I really want to just talk about. Really, we have so many questions from a lot of people in the audience that want to, but I want to kind of save those for the end of the show or towards the end of the show. But we can go any direction. I kind of think maybe let Dr. Brett and Dr. Leonard tell the audience about themselves a little bit, their backgrounds and their practices, and then just give kind of a broad perspective or a horizon of like what they're doing in their current practices and how they can help people with their health and fitness.
Okay.
Len, I'll defer to you.
Yeah, Dr. Osborn, why don't you start first?
Okay. My background is as follows. I originally became interested in nutrition and exercise at a very, very young age. And during my neurosurgery residency, which began in 1996 at NYU, I came to the sort of understanding that a lot of the diseases that we were treating sort of in an after-the-fact manner, as opposed to treating these diseases prior to their manifestations. And those diseases include diseases such as cancer, which is Dr. Farber's specialty, degenerative diseases of the spine, etc. And I also came to the understanding that these diseases were really of common underpinnings. And one thing led to another, and I became more and more interested in nutritional strategies as a potential preventative measure for these diseases, supplements, exercise, and then I did more and more research, and ultimately obtained my certification in anti-aging and regenerative medicine, and my CSCS from the National Strength and Conditioning Association, because one of the things that I've always been interested in is exercise, and more specifically human performance, and that includes both physical and mental aspects of human performance. And to this day, I'm extremely interested in both of them, and maybe even more so the latter, the mental aspects of training in particular, and how we can push ourselves to higher and higher levels, even as we age. And there's, I'm always looking, as Jay and Monica will tell you, I'm always looking for sort of the next thing, and my head's in the literature, and I'm looking for the next sort of tweak and body hack, if you will, all in the context of not so much being able to bench press or squat heavier weight, but more so from the standpoint or in the context of health, because ultimately we're going to unlock these secrets, which will allow us to not only extend life, but better both our physical and mental performance in the context of health, and not by virtue of sacrificing one's health. And that's really where my interest in TRT or HRT really lies, because these things, while they do have an associated stigma, these are the potentially one of the secrets, not so much the fountain of youth, but one of the elixirs of youth, and it's extremely important to incorporate these types of strategies into one's regimen at this in this day and age, until better technology comes around from the standpoint of pharmaceuticals, natural remedies, and potentially even the integration of electronics into our nervous systems. So that's really my background in a in a 5-minute circuitous.
And Dr. Osborn is definitely a living testament. I'm not kidding you. This guy is in amazing shape, and his book, Get Serious, is phenomenal for anybody out there.
Yeah, guys, just real quick, just to plug his book. We'll talk about it later, but it's funny because I'm very, very well read, as both of these doctors are too, and as is Monica in the health and fitness genre. And I got Dr. Brett's book about 9 months ago, and it was right about the same time that he and I met each other through social media. And I read through it, and I was like, oh, wow, and then I started reading through it again, and it's just, it's just an amazing forum. I mean, there's just so much information, and he covers a wide, swath of information from training, from optimizing your hormones, from nutritional supplementation. I mean, it really is a power-packed book, and we recommend that you guys go to Amazon.com and buy it. I mean, it's really for any level, though. I mean, it's a 20-year-old girl and a 70-year-old guy can use the information.
And what I love about it is that not only does he talk the talk, he walks the walk. So you can look at him and say, wow, this guy knows what he's talking about. Okay, absolutely. So we love you, Brett, and let's talk to Dr. Farber.
Well, I don't know if I can top that, but I'm going to give you my perspective.
You can do it.
Well, one, I really appreciate the really heartfelt introduction. It's been a pleasure working with everyone. It's been a great journey so far, and I know we've just begun this process together. My background and interest, similar to Dr. Osborn's, has been sort of my personal journey. I started getting interested actually in bodybuilding in the 80s, early 80s in junior high, and the only gym available in Queens at that time, I had to go to Jamaica, a tiny little place about the size of my bedroom now, and it was a spot that Lou Ferrigno used to hit training for Mr. Olympia.
Wow.
And then I had a passion for getting into fitness and building up sort of both aspects of my core being, so mentally and physically, and I felt that they were very much intertwined. And I got to watch the evolution of fitness into our society when the only other gyms around were Jack LaLanne, and then over the next few years, everything opened up, and I got to see Gold's Gym, Ferrigno's, to now, Equinox and Crunch, and really, you name it, they're all on every corner. But that's really a testament to society's evolution of how fitness plays a core into our everyday being. When I did my residency, I was at the University of Pennsylvania, and I really started to bring fitness back into my lifestyle. And I would go to the gym late at night when I was doing even my internship before. Before that, I would do the overnight shifts, as Brett will know, and I used to hit a 24-hour gym at 5 in the morning after finishing, because without that part to my life, I was running half a person. And as I've aged, I've learned to incorporate that into my mainstay of my personal philosophy, and have subsequently introduced it into how I view patients and treat patients. And what's evolved in the cancer world, as everybody knows, is that people want to know, how can we prevent disease?
Right.
Not just treating, as Dr. Osborn said. Let's look at the causative agents. And society as a whole, medical society as a whole, really has very little hard evidence to support the way we've been following the food pyramid. And I think it's breaking out of that box at every step of the way in science and challenging dogma to say, what can this mean? Where can we go? If it's not working, then we need to shift where we are. And I think that's what brings us all together tonight. We're bi-coastal. We're actually, well, almost tri-coastal, right?
Right.
and yet we all have this commonality amongst each other, and it really transcends, across the entire globe. People are interested in all of the same things. And I think by having these forums, we can really educate people, and we evolve collectively as human beings when we can integrate our knowledge and touch each other in that way.
Absolutely. We are so privileged to have both of you here. Thank you, guys.
Awesome. Scott, do you want to just kind of moderate from here and just,
Yeah, so, I mean, there's so many things that we can get into on this subject, but, I mean, I guess, you guys both mentioned, I think that's real important, is, preventative measures to being healthy, being fit, and staying, keeping yourself healthy so you're not getting diseases or getting cancer or so what are some of the things, like just some of the basics that you've learned and that you incorporate into your training your patients or helping your patients and guiding them into ways to stay healthy, stay fit, and prevent themselves from having to fall into those traps of running into diseases down the road when they get older?
I'll jump in with some basics, and Dr. Brett, you can go into some more specifics. I sometimes deal with patients who come in with zero knowledge of nutrition, and they say, what's a carbohydrate? Is bread a protein? And we have to really start at the beginning. So one of the things I really tell people is, let's start with balance. Okay, you don't have to go all in to start to make some changes. The first thing is really educating and learning some of the basics about food groups. Not necessarily the food pyramid, but let's understand what proteins are, what are simple carbohydrates, what are complex carbohydrates. And it's not a one-stop shop kind of philosophy. I have patients that say, well, listen, now that I'm diagnosed, I want to make a change. I want to stop eating animal protein. Where does that fit in? And I'll refer patients to books like the China study. So it's really, from my standpoint, is getting to some of the just real fundamentals of eating better, of staying away from sugars, of cleaner eating, of moving away from processed food. And that is more of a healthy shift. And I think Brett's been taking that now, well, not just now, but a real step further to talk about, once we're there, how do we maximize? How do we go from just being, say, in okay shape to being in great shape? And so I'd like to let him talk a bit about that.
Right, and that's a great point. And one of the things that I tried to get across in the book was the fact that you need to understand, and this is how I counsel my patients, you need to understand the underpinnings of these diseases, one of which is the aging process itself. I mean, I consider aging disease which ultimately will be slowed down initially and ultimately will be cured, or the secrets will be, if you will, the secrets will be unlocked and allow us to cure that disease. So I start with just basic education, as you do, and I talk to them. I talk to the patients at length about the underpinnings of diseases, what inflammation is, how it's linked to cancer, why it's important to not only eat as clean as possible, but to get on anti-inflammatory agents, natural, pharmaceutical, keep their blood sugars under control, because one of the sort of entities that primes the system in general for disease is insulin resistance, and that's a big issue, and that's why a lot of my patients, I'm very, very aggressive about putting these patients on metformin and keeping their A1Cs basically as low as possible, as long as they're not exhibiting any symptoms of hypoglycemia. It's extremely rare to develop that with metformin. I will be extremely aggressive about even putting non-diabetics on metformin in the context of cancer prevention, etc. And it's not just cancer that's related to insulin resistance, but really all these diseases. Alzheimer's disease is called type 3 diabetes because it too is heavily integrated with insulin resistance. So I use a lot of metformin. I use chromium. I use cinnamon. Things like that, agents like that, natural pharmaceutical agents in order to keep control of patients' of blood sugars long term. And I use a lot of anti-inflammatory agents, both natural and pharmaceutical, in order to dampen bodily inflammation. Because all of us are running around, as you're well aware, with some sort of low-level inflammatory state to begin with, and then a lot of us are running around actually with high levels of bodily inflammation. It's one of the things that I check during my routine surveillance labs. Is I'm always checking patients' inflammatory markers such as CRP, homocysteine levels, because these elevations in these inflammatory markers are associated with all age-related disease: cancer, diabetes, atherosclerotic disease of the heart, cerebrovascular disease, stroke, heart attack, etc. They're all inflammatory diseases, period. So these diseases have common underpinnings, and these are the things that I try to counsel my patients about in the context of health and prevention. So I'm always trying to get them to sort of become as knowledgeable as possible, and then sort of make that leap between not treating diseases after they become apparent, but getting on these agents sort of prophylactically. And I think that that's one step closer to slowing down the aging processes, in addition to preventing these disease entities themselves. So you have to start considering aging as a disease. So we're all afflicted with that disease come 16, 17 years old, and the clock is ticking. There's a movie that I oftentimes quote in when I give lectures. And that's the movie. Of course, the name escapes me right now. It's with Justin Timberlake. You guys have probably seen it, where when they're 16 or 17 years old, they're given this. Sort of the clock starts ticking.
Yeah, it's called mnemonic, right? Mnemonic? Mnemonic or mnemonic or something like
no,
that?
No, it's something I'm going to do with time or something.
Yeah, it's an awesome.
They have a digital clock, and as soon as they're 16 or 17 years old, the clock starts running backwards. It counts down to, if you get to 0, then you're dead. And that's sort of a paradigm for aging, because aging doesn't start until you're in your teens, and we know that of epidemiologic data, but you don't really age until you're 16, and then after that, okay, you start sort of going down a hill very, very, very slowly. But we know that by virtue of the fact that mortality rate doubles every 8 years after we are a certain age. I forget, it's 18, 19, something like that. Every 8 years, your mortality, your chances of dying, okay, doubles. So, and this is hard data. There's no question about it. Okay, once we are, whatever it is, I forget the exact number, 16, 17, 18 years old. Okay, the clock starts ticking. Okay, and you need to understand that. Okay, and this is what I talk to my patients about. And you need to do everything you can immediately. Okay, unfortunately, we're not taught this in high school. We're not even taught it in medical school.
Right.
You need to start dampening those effects immediately. With exercise, you need to prioritize your health. That's a big thing I talk to my patients about. Make health a priority. Exercise, clean your diet, get on hormones, okay, if you are deemed candidate for that based upon your serologic studies, okay. These are the things that need to be done early on, okay. Don't wait until you're 70 until you realize, well, geez, you know, my testosterone level is 0, my libido's in the garbage can, I'm sarcopenic, I have no resilience to disease, because as you know, the resilience to disease lies in our muscle. Okay, so we want to go into old age, okay, if you will, with as much muscle on our body as possible, as strong as we can, because that is something that is our strength is directly correlated to our morbidity and mortality, all causes. You go into your older years, if you will, with being strong and with a lot of muscle on your body, you're going to be much more resistant to the development of age-related disease, and you're less likely to die should you get admitted to an ICU. And Dr. Farber will certainly testify to that. I mean, the people that have cancer, those individuals that are stronger individuals, okay, as opposed to those individuals that have very, very little muscle mass on their body, they do much better, period. Much more resilient to disease.
What I hear from you too, Dr. Osborn, is that essentially it's important for people, and any individual, to take control of their aging process and start as young as possible. Now, not to say that if you haven't started that, it's over, but to start from a young age and actually start designing how you want the rest of your life to look like, and by making conscious choices as to your physical fitness, as to what you're putting into your body.
That's right. And again, this is one of the themes of the book. Okay, and I'm not plugging the book at all. Forget about it.
We are. We're plugging it.
Right. And I appreciate that. But you need to understand these things early. You need to prioritize. You need to assume control of your health. Okay, don't leave it in the hands of your doctor. Okay, because 99% of the doctors that are out there, they don't have this mindset. Unfortunately, ultimately they will. Okay, but we need to be very, very assertive in our preventative stance. And try to resist the aging process. By resisting the aging process and considering it as a disease itself, okay, you're going to lower the incidence of not only aging, slow the aging process down, but you're also going to lower the incidence of age-related disease. Okay, again, cancer, diabetes, hypertension, all of these diseases are the same.
Okay, so real quick, hold on, Jay, real quick. Everyone that's watching, in the upper right corner, there's little squares in a box. Click in there. You can hit the Q&A, and it'll pop up, and you can ask questions, and the docs here will get them answered while we're live. All right. Go ahead, Jay. Sorry, I didn't mean to interrupt, man.
No problem. Doc, I want Leonard to chime in on this too, but first, Brett, Dr. Osborn, I really liked what you said about aging and how eventually as a disease we're going to tackle it and we're going to extend lifespans dramatically. Maybe pontificate a little bit on that as far as where do you see in 25, 50, 75 years from now, what will the average lifespan, and what could the actual human body live to? What can you think we can ultimately live to?
Leonard, do you want to answer that?
Yeah, well, so we can look at it from the medical sense and say, well, we really don't know. But there is nothing to define there is a limitation at all on the lifespan of our cells, okay? There's actually a quote, and I'm not going to quote it verbatim, that says, it's just a matter of time before we come up with a solution to this disease process. And I agree with Brett wholeheartedly. That's what this is. This is our challenge of our time to understand the disease process, the aging. And we are now tapping into pharmaceuticals to either slow it down or reverse it. For those people out there who follow, some biblical stories, people lived to hundreds of years. Now,
right.
I mean, there are stories of people who live to 400, 800 years. Look, the reality is we don't know our potential, and we are tapping into it to the first time in our society now to say, this is a disease process. How do we challenge it? And you can start to see, I tell my patients 90 is the new 70, we are living longer, healthier, because we are making decisions that are born out of education, both in medicine and in, basically the bigger societal view of eating better, and now coupling that with our medical advances. I mean, I think Brett nailed down so many good points with incorporating metformin and discussing insulin resistance. That is really the key path right now. And I mean, I use metformin myself. I talk to my patients about it, and even understanding how TRT works. And we've now looked at it and breaking away from our stereotypical dogma and are trying to grasp it in the medical world, which usually lags behind some of the other cultural societies, and bringing that in and making it, I don't like the term anti-aging, it's really anti-disease, where the disease is the aging process.
So Doc, for someone that's watching this, like me, for instance, that doesn't understand what those terms are and what Metformin is, and can you kind of go into detail a little bit more about on what those things do and potentially how they help you?
Think 8th grade explanation.
Brett, you want to go with this one?
Leonard, you want to go ahead?
Brett, Brett, go ahead, because I know you prescribe a lot for your patients. I would actually be interested in hearing what you tell your patients.
And I'm going to try to make this as easy as possible. I usually explain to my patients that this is that aging and diseases in general are associated with high insulin levels in the body. Okay, and insulin is not only is it a growth hormone, but it's an inflammatory hormone. Okay, so when you have a lot of sugar floating around in your body responds by making insulin. Ultimately, the body the cells become relatively resistant to the effects of insulin, and by virtue of that, the body sees that as it's like the boy who cried wolf, and that's what I describe it as. In other words, the body becomes so tuned into a certain level of insulin because there's a lot of sugar floating around, that what happens is that the body, in response, secretes more insulin in order to get sugar into the cells in order to lower the blood sugar, because our bodies like to run within a certain range of blood sugar, and ultimately the cells develop resistance. So just like the cells, in the boy who cried wolf, you just start ignoring the signal, and what happens is that when the cells start ignoring the signal, that is what is termed insulin resistance, and more insulin is secreted as the cells are ignoring the insulin signal. So more and more insulin is secreted in an effort to drive the sugar into the cells. And we're running around, particularly individuals that are obese, with high levels of this hormone that the cells are ignoring. And by virtue of that, it's like pouring gasoline on a fire, because not only does insulin an inflammatory hormone. Insulin is an inflammatory hormone, so it causes more inflammation in the body, and that primes the system for age-related disease. In addition to that, insulin is a growth factor. So if you have, and Leonard will tell you, if you have a lot of insulin floating around in your body, if you have a lot of sugar floating around in your body, and by virtue more insulin, cancers are going to be if you will, prompted, okay, to grow. So there's a whole biochemical explanation as to why high levels of insulin are bad, but that's sort of what I explain to patients, and I usually just say generically, you don't want to be running around with high insulin, you don't want to be running around with high blood sugars, and in order to temper that, we're going to put you on a medication which will lower your blood sugars, and by virtue of that lower your bodily insulin levels, and by virtue of that lower your risk of cancer, and by virtue of that lower your risk of inflammation in the body, and by virtue of that lower your risk of age-related disease. So I sort of just tell them that it's a good medication to be on because it's going to lower your incidence of all of these diseases, including cancer. Okay, so that was a circuitous answer. It's difficult to explain, and like I said, there are very, very intricate biochemical pathways which are related to growth hormone. Growth hormone, and more specifically what's called IGF-1, is very much related to insulin. Both of these are growth factors. A lot of these, too much of these, not normal levels or optimal levels, but too much of these hormones within the body primes the system for age-related disease. So it's one of the ways that we can temper or dampen the effects of potentially not the best diet, and a lot of these individuals, despite my counseling, despite me
so let's talk about that a little bit and kind of dive into what things should people be avoiding all the time and should never even never eat because
Right.
it's like tons of sugars and it spikes your insulin. Let's talk a little bit about that.
And that's exactly what happens. In other words, as you had said, it's really the high glycemic index carbohydrates, okay, the simple carbohydrates, okay, which prime the system for age-related disease by virtue of their effects on insulin, okay. So high levels of sugar continually, the system interprets that as, well, we need to deal with all that sugar. We secrete more insulin, there's more inflammation in the body, okay? There's more oxidative stress in the body, okay? And again, it primes the system for all of these diseases, including aging. Let me tell you another sort of corollary to that. If you look at the people, there's only one known modality at this point to extend life. That is called caloric restriction, or CR, okay? And that's where we reduce our calories, okay, by about 30%. And the people that are practicing CR, while they may be smaller individuals and have less muscle around because there's less growth factor around, because you do need some insulin to drive muscle hypertrophy, because, as I said, insulin is a growth factor. It grows muscle as well as growing other bad things in the body like atherosclerotic disease, etc. The people that practice CR are hoping that ultimately they will live longer. Okay, but it's a miserable existence, okay, because they're really depriving themselves of some of the foods. And let's face it, we all like to eat, okay. And when I talk to my patients, I'm aware of this fact. We all like to eat, okay, foods that taste good, and there's nothing wrong with that, okay. But if you're going to eat some of the bad foods sometimes, okay, and keep a strict diet 90% of the time, that's okay. You are human, and what I do in order to dampen the effects of those bad foods is I make sure that my patients are taking lots of omega-3s, taking metformin, exercising, okay, because you are buffering the untoward effects of these bad foods, okay, by virtue of the fact that you're using all of these modalities, okay. Ideally, you don't want to eat any of these bad foods, but I'm not telling you that you need to be practicing calorie restriction. But metformin puts you slightly closer to calorie restriction, a calorically restricted state, by virtue of the way it acts. Okay, so you sort of get the benefits of calorie restriction, even though you're not necessarily calorically restricted, if you use metformin. One of the other things that we can use, which sort of mimics this state, is something that's called intermittent fasting, and Jay and Monica know a lot about this. Okay. And that's creeping closer, okay, and you can do it on an intermittent basis. It's not the easiest protocol to follow, okay, but it sort of does the exact same thing. Leonard, what do you think about this?
The omega-3 that he recommends.
Yeah, just so you know, Scott, like omega-3s, basically fish oil capsules, but pharmaceutical grade. So, like can you see it? Every person should be taking these a day. Like, Dr. Brett works with both of us, Monica and Jay, guys, and we can't recommend him high enough, obviously. And then I also work with Dr. Leonard, but you have me on 5 grams of this a day, correct?
That's right. That's absolutely.
And then what about the metformin? Is that prescribed only, or is that something that you get as well?
No, that's a prescription. That's a prescription. And
then how do you prescribe that to people? Is that generally like preventative, like we're talking about?
Right. I do. I don't know what Dr. Farber does in his clinic. I don't know if he prescribes it as a preventative agent. I do. I'm very aggressive with it. I write it literally, and its side effect profile is excellent. I mean, it basically doesn't have it's associated with very few side effects. If you talk to other physicians, they may say it causes problems with the kidneys. Never seen it happen ever. Unless you're floridly dehydrated, not paying attention to your water intake, and running 17 marathons a week, it's extremely unlikely. Honestly, it's extremely unlikely that you're going to have any problem. I've prescribed it many times, a myriad of times, and I've never ever seen a problem with it. It works. We don't quite understand how it works, its mechanisms of action. We do know that it does inhibit glucose release from the liver, but there is a whole host of other purported mechanisms through which it acts We're just unsure. Bottom line is that that drug has been around for nearly 90 years, 90, and the side effect profile is excellent. It's time tested. Some people, anti-aging folks, if you will, are using things like Actos or pioglitazone, blah, 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 in order to affect a similar type of response, lower one's bodily insulin levels, etc., lower one's fasting sugar, lower one's A1C, all doing the same thing. The problem is that these medications, these newer medications, are associated with side effects, and the other thing that's bad about them is that they are extremely expensive. Just so you're well aware, metformin is free at Publix, free. Okay, they're giving it away. They are giving it away. Maybe that's a sign.
Yeah, I personally have been using metformin for probably 6 or 7 years, and it's
Where do you get it, Jay? I mean, if someone wanted to go get it, I mean, they can get it at a pharmacy, or they have to go to a doctor and get it?
You have to have a prescription from a doctor. You know, you want to work with a guy like Brett.
Okay.
You know, there's a million. I mean, but there's a million doctors that, you know, I shouldn't say a million. There's plenty of doctors that will prescribe it. But most of them are usually prescribing it, and you guys correct me if I'm wrong, but most of them are prescribing it for people that have type 2 diabetes or other insulin issues. So it's not, from a life extension or anti-aging perspective, a lot of doctors really aren't smart enough or aren't hip to doing that, but I think as it goes forward, more and more doctors will be. I mean, they have to be. I mean, it's an amazing medication. It's like you said, it's anti-cancerous. You know, there's so many different things that it does.
There's so many benefits, absolutely. And Dr. Farber, I don't know if you want to piggyback on any of that, or you want to add anything as well. We'd love to hear your insights as well.
Sure. I was actually, it's funny because I'm sitting here listening and really enjoying this. It's informative in many different ways. I wanted to jump in, but it was about 20 minutes ago. I really liked Brett's analogy of the boy who cried wolf. This is the story of the body that cried sugar. Metformin is something that so just to give you an example to all the people out there who are knowledgeable, but to different degrees, I didn't really get into understanding metformin until about 3 months ago. All right, so this is new to me, and as I've learned about it, it is amazing to me that this 90-year-old drug and its activities on the body was not in my mainstay regimen of understanding how it works. So in the last 3 months, I've just pretty much put everybody on it who's been interested in integrating nutrition into their therapies and their treatment. Metformin also has anti-proliferative action on cancer cell lines. So proliferation essentially means growth and development. There are some direct activities on a whole bunch of cancer cell lines, from breast, colon, ovarian, pancreatic, lung. It's actually been demonstrated to have biological effects directly in studies in breast and colon cancer. So I have now started to incorporate it, and remember that a lot of my patients are coming to me solely for cancer treatment, not for the anti-aging process. But it's only in developing a relationship with them that they start to feel comfortable and say, okay, how can I incorporate diet, nutrition into my lifestyle and of preventing a future cancer or to healing better while on my treatment? And that really opens the door for me to start discussing all of these different options. So it's really a testament to how little not only the public knows, but those of us in the medical field know. I have been circuitously and directly involved with the transition at 16 into bodybuilding to revive my way of incorporating strength training, diet, nutrition back into my lifestyle at about 42 when I was first introduced to Jay, and then that was reinforced when I was introduced to Monica, and then Jay went to the back burner because, you know.
Them women, I'm telling you, man.
He does look a lot better than me in a bathing suit.
But the reality is, and back to some of the core issues here, if I could take sort of the layperson's approach, I took an approach personally where I said, okay, I understand the mechanisms of these drugs, of nutrition. I said to Jay, I'm 42 now. I need to be in peak shape. What do I do? Okay, I almost forgot my medical training. It's kind of like when you have kids and you're a doctor, you don't know what to do when your kid has 100-degree fever. All of a sudden, you forget everything you know. And I said, I want to look at this from a different perspective, and you know, I'll never forget where we went through a whole regimen, and I started to really lean up, leaner than I had ever been, and I would send Jay pictures, right? Nobody else got these semi-naked pictures.
I got them.
No, mine was all.
Eventually, I sent it
It was
to him.
amazing, everybody.
When Jay finally gave me the approval, which was not easy, but every step along the way when I thought I looked great, and again, this was incorporating my physical appearance into my whole core well-being, and it wasn't just for the aesthetics. But Jay would say, "That's great, more cardio, less eating."
Or less alcohol, right.
You know, and every step of the way was, "All right, more cardio. What are you not doing right?" He would ask me to send him my nutritional diary, and I never sent it because I knew what was wrong with it. But that's what people should do, is keep a nutritional diary, because that's where you're calling yourself out. I knew if I looked at it, I didn't realize I was eating these complex carbs all the time. Oh, that one drink of alcohol, or 2 drinks, or 3 drinks. I mean, some people will consume 5 drinks a night. Forget about the wasted calories. They're not even talking about the decreased metabolic effects from alcohol. And all of a sudden, there's a check system in place, and those are simple things people can do. But it took like Jay and Monica, because after a while I didn't really care what Jay thought. I cared what Monica thought. But it
I'm easy to please. Sorry.
it really takes a checks and balance system. And if you can't have it within a friend, it's great to have it with a physician. And I think what's great about what Brett does is he actually represents both aspects. He is the physician, he is the personal nutritionist, if you will, the trainer. And you know, I just got his book 2 weeks ago, and I can say, wow, I was really super remotivated to get over this current plateau. And people should go to resources like Jay and Monica and like Dr. Osborn to say, just like I did, I want to learn more. What do I do next? And it's sometimes just asking some of the simple, basic questions that will take you there.
And Dr. Farber, real quick, and Dr. Osborn, what I think is most important, what I hear from both of you, is that people have to have enough value in themselves to look at what they're doing, to decide how they want their life to look like, you know, whatever it is, and go to professionals such as yourself or somebody to actually have, you know, a diet set up for them, and then use the steps that are necessary to acquire and have the life that they want, right?
Yeah, exactly. It starts from within, and that's the drive. And as Brett said, it shouldn't have to start at the midlife crisis.
No way.
We recognize that now. I teach my daughter at 9 years old for the last few years to really reflect every night and say, what do I want? Okay, ask a question. Start with a question. What do I want my day to look like tomorrow? What do I want to feel like tomorrow? And if you start asking yourself that at any age, I can tell you what the answer is going to be. I want to feel better. I want to be healthier. I want to look like X, Y, or Z. Those are some core questions that will lead you on the path. There's no, really, other than some pathological mental condition, people want to be happy, they want to feel good, they want to look good. That is what drives us every day to get out of bed and do more. And I think that you don't need to wake up and say, oh, I want to be a bodybuilder, but I will tell you, if you have that core drive to be your best, every step of the way you're going to hit a plateau and push further and not stop, not be satisfied with where you were, because every day this is where you are now. And I can personally attest to where I am now, which is light years ahead of where I was 2 years ago, which was so much better than where I was 4 years ago. And then having just gotten Brett's book 2 weeks ago, I've become completely dissatisfied with where I am now and want to take the next leap. And that's what we're hoping people do at every level of where they are now. So it doesn't matter if you're 40 pounds overweight or you want to go from, there's the book. 20% to 10% body fat. It's
And then, hey, that's Dr. Osborn. Look at them abs. Bam.
That's
Bam.
not. It's actually a stunt double. It's a stunt
Bam. He is ripped.
All right, well, just real quick, you guys, honestly, like, both of us are so honored. I mean, both of you guys have dropped so many amazing bits of information. Scott, I know we have a lot of questions probably from the audience. We got about 15 minutes left. I just want to say that I personally, after today, it was so awesome. I would like to make this a regular with both of these guys if they can, find the time in their schedules. I know there's so many people in North America and really around the world that can use this kind of information. So
at any point, whenever
with that
you guys
said,
feel
if some of the questions are not answered today, believe me, we will answer them down the road.
I mean, there's so much that we can get into. I mean, I've literally asked these guys like 3 questions the whole time, and it's just like, there's so much information.
Scott, I really think, if these guys are, can find the flexibility in their schedules, and I know they're both busy guys, but I mean, we don't even need to bring other people on. I mean, this thing could become so big and so powerful because, I mean, these are 2 doctors who literally live a health and fitness lifestyle, and as both of them have said, there are not a lot of doctors that are walking, talking, breathing, mnemonics of what people want to look and feel better about themselves. Like, like what Dr. Farber just said about, like, people really do wake up every day wanting to feel better about themselves. And here's 2 guys that can not only, make them or help them do that, but, are walking the walk and talking the talk.
Exactly.
So I want Dr. Osborn to jump in real quick, but then and add a couple comments, but then I want to answer a lot of questions because I know there's a lot of questions.
Tons of questions.
Right. Piggybacking on what Dr. Farber had said, one of the things that I try to stress to my patients is the fact that a little education, just a little knowledge, goes a long way. And it's not the fact that you need to turn yourself into a bodybuilder. I don't look like that because I'm going to be standing on stage anytime soon. It's really not my goal. The way I look is purely a side effect of my strength and the fact that I'm constantly trying to push the envelope, as I had said before, both from a physical and a mental standpoint. So I look that way only by virtue of the fact that it's a side effect. It's not because I'm on this drug or that drug or anything else. I have my hormones optimized, yes I do, but it's not. There's no intention of standing on a stage like Monica and Jay have. I know in the past because they're both fitness competitors. But I really don't have any aspirations to do that. This is all in the context of health, and it takes a tremendous amount of discipline to do what they both have done in the past. I may or may not have that discipline, quite frankly. I just do it because I want to be able to sort of push the envelope, and I look the way I look, and it's all good, but it's not by virtue of the fact that I'm trying to look a certain way. I'm trying just to maintain my health, and I look that way as a side effect of my habits. And you may not look like a bodybuilder. You may not have the genetic makeup or the fiber typing to ever look like a bodybuilder. It doesn't matter. You will make dramatic changes in your appearance and in your internal biochemistry if you just pay attention to some of the simple things that we discussed here earlier. You can make dramatic changes, and it's all under your control. Don't wait. I'm sorry?
Amen.
So, real quick, before we get into some of these really detailed questions that I have, what are 3 things that someone, that if they're not doing anything right now, that they can take away from this today, implement in their daily lives to start working towards this preventative action to be healthy and stay away from, going into their older age and staying away from diseases?
Len, you want to take that?
Sure. I mean, just fundamentals. 1, diet, okay? And in that diet, I would say, well, first, with diet, I'm going to say the obvious, no smoking. Let's just start with no smoking, okay? I don't care how you look at it, no smoking. 2, let's talk about clean eating. And with clean eating, I mean stay away from sugars as much as possible. Stay away from processed foods. And then the 3rd component is exercise. If you start with those as fundamentals, you will make a change. By exercise, when people say to me, I don't know, what is exercise? What should I do that's going to help? I usually start patients, or friends for that matter, on a cardiovascular routine 3 to 4 days a week. So for those people who have never been into a gym, I say some good cardio. Unless you are an avid runner, running can be hard on the knees and the joints. So get on a Stairmaster, get on an elliptical. There's tons of different cardio. But if you can start with 20 to 30 minutes a day, and I recommend interval training, and we can get into more of that later, you now have a fundamental, right? You have a cardio routine, so that's your exercise. You have an eating routine, and then we can get into the supplements. No smoking, minimize your alcohol, and there's your basis, okay? And everything else you start to implement as you develop. But there's no reason any listener can't get up tomorrow morning and implement those 3 things.
Right. Go ahead, Dr. Brett.
Awesome.
I have to echo those sentiments exactly. Exercise, stay away from the sugars, and everybody, barring any unforeseen, barring any contraindications, should be on aggressive, natural anti-inflammatory agents. These things are very, very simple, and they make dramatic changes in your biochemistry. So the high-dose omega-3 fatty acids that Jay had spoken about, extremely, extremely important. Okay, they will dramatically change your biochemistry, and they actually have lipolytic, so fat-burning effects. And let's face it, every single one of the listeners out there, myself included, can afford to lose a little bit of fat, maybe except Monica. But high-dose omega-3 fatty acids, high dose. Okay, unless you have some sort of allergy, as I had said, you may want to incorporate aspirin. You know, I'd like to know what you think about that in the context of chemo prevention for cancer, because I use it aggressively in my patients just by virtue of that. Exercise and keep the sugars down. One of my nurses, just very, very quickly, and I know I'm not very quick with the things that I say, and I'm all over the place, but very, very quickly, my nurse lost 60 pounds in 6 months. Okay, with Osborn's rules: no soda, exercise 45 minutes a day, no eating after 7, avoid all non-vegetable carbohydrates. Again, avoid all non-vegetable carbohydrates. No eating after 7 o'clock at night, because that puts you closer to a fasted state, a calorically restricted state. So you're fasting from 7, just to say you wake up at 7 for 12 hours. Okay, so you're burning fat during that time predominantly. Stay away from the soda. Exercise every day. High-dose omega-3 fatty acids. Okay, if you just listen to those basic rules, okay, you'll drop 20 pounds in a month. Okay, because your insulin signal is going to be lower. Your insulin signal is going to be lower. I just had my insulin levels tested, and they were in the low 2s. Okay, which is where you want to be living. If you're living in a low insulin state, okay, not only is that going to potentially confer longevity, but it's going to reduce your incidence of age-related disease. Again, cancer, diabetes, atherosclerotic disease of the heart, of the brain, Alzheimer's disease, all these diseases are the same.
Yeah, this is so gold. Scott, can we go off like maybe 5 minutes later so we can answer most of the questions?
Yeah. We can keep going. Absolutely.
Okay, I'll just keep going.
But we got to honor. Wait, we got to honor both of the doctors' times. I mean, are you guys okay to go 5 minutes beyond?
Yeah, I'm just got to grab some melatonin for my daughter, actually. She's on her own routine too, so I can bring the laptop with me as we go.
There you go. There you go.
Okay. Well, just cool. 5 minutes. Just 5 minutes.
Yeah.
No worries on my end.
So, we got a question here, and says, I'm 51-year-old former Metzer client on TRT. I've made great progress in my training and diet since discovering FabFit. I'm reading Dr. Osborn's book, Get Serious, and applying your tips. My protocol, I've included Metformin within the last week. My blood glucose levels are in a healthy range because I'm monitoring them as per your suggestion. What can I expect to notice by including Metformin to my regimen?
Len, you want to answer that?
I think he's on mute. Go ahead.
Yeah, go ahead. Go ahead, Dr. Osborn.
Yeah. So Metformin, as I had said before, it's extremely rare that you're going to have an individual come, okay, and complain to you that they're having symptoms of hypoglycemia. as a result of metformin. It just doesn't do it. You're not giving an individual insulin. It's completely different, where they can bottom their sugars out, and we see that all the time in the emergency room. It just doesn't happen. I'm to the point with my metformin where I'm maxed out, okay, 1,000 milligrams twice a day, and my last dose of metformin, my second dose of metformin daily, is actually at 10 o'clock at night or 11 o'clock at night before I go to bed with no food in me, none. So on a fast. In other words, I've stopped eating, just to say at 7:30, 8 o'clock at night, and my metformin goes in with my nighttime supplements. So with the omega-3, with the omega-3s, with the resveratrol, with my aspirin, metformin, my last dose of metformin goes in. Okay, and I have never had it correct. There it is. Absolutely. I've never, ever.
On our next show, we're going to talk about an anti-disease, borrowing Dr. Farber's supplement protocol. Continue, Dr. Brown.
Yeah.
Awesome. I'm looking forward to that. Anyway, I need to learn more. So the metformin, it's just not an issue. It's really, really, really not an issue. It's extremely unlikely. If it did happen, if you were having some symptoms where you felt jittery, you thought your blood sugar was low, what you would do is you just back the dosage off. That's all. But again, I'm maxed out on metformin. I'm not a diabetic, and I have not had a single issue with it. Have I had?
Well, your issues are fat loss.
Yeah, that's one of the side effects. We're not supposed to say that, though. Again, right, by virtue of the fact that your insulin signal is low, remember, every single quote-unquote diet is associated with low insulin levels. So all we're doing is we're driving insulin levels down, and when you have low insulin levels, you're in fat-burning mode. Metformin puts you closer to fat-burning mode, or it puts you in fat-burning mode if you're sort of sitting on the edge, and you will, in all likelihood, lose weight. Okay, it's the I would say the most common side effect, if you will, of the medication, but it shouldn't be written exclusively for weight loss. I'm not supposed to say that.
All right, next question.
All right, next question. What is your thought on the use of Armodex? It is commonly prescribed by many anti-aging doctors, including my own. What do you consider a beneficial range for a male to have his estrogen level at?
Right. Leonard, you want to answer that?
Yeah, I'll answer the first part. So Arimidex is one of the many anti-estrogen drugs that are out there. Most men will go on it to balance out the side effects of being on a high dose of testosterone. Anybody going on an anti-estrogen needs to get this from a physician, because it should not just be prescribed because you are taking a testosterone supplement. Now I'm talking outside of the cancer world. The Arimidex and the other drugs have an anti-cancer effect in breast cancer, but that's really not what we're asking here. We're asking here, in the supplement world, where does a drug like Arimidex fit in? Again, if you are taking a high dose of testosterone, or your body metabolizes in such a way that you aromatize, you're going to develop high amounts of estrogen, and specific estradiol. So you need to have those levels of estrogen, estradiol monitored in order to understand what anti-estrogen you should be on and what dose. There are other drugs such as tamoxifen, Novoldex, exemestane. Those all have different anti-estrogen mechanisms of action. Some people should not be on Arimidex, which completely blocks estrogen production, whereas some people should be on it because they are not getting the appropriate amount of anti-estrogen effects from trying one of the other agents. So in general, we use it to balance out the aromatizing effects from being on testosterone, but you should, or you must, have that monitored with blood tests to see if you need it, and then once you're on it, you need to have that regulated in terms of the dosing.
Anything to add, Brett, to that?
No, I think that's exactly my sentiments. I would just make sure before you are placed on a medication like anastrozole, Arimidex, or one of these other estrogen blockers, if you will, that you qualify to be placed on a medication like this in the context of what your laboratory values are. So I usually try to run my men that are on TRT somewhere around 20, because even men need estrogen for cardiovascular, its cardiovascular effects, and from the standpoint of our bone health. So we all need it. You don't want to be running around with an estrogen level of 0. That being said, individuals that are insulin resistant and are carrying around a lot of fat mass, okay, because the aromatase enzyme, the enzyme that changes testosterone into estradiol, resides in our fat. So those individuals that are running around with a lot of fat, they tend to be running around with a lot of estrogen, and those individuals, especially if they're on TRT, in all likelihood are going to need to be put on an anastrozole or a Nolvadex, whatever you happen to be using, in order to block. I use anastrozole because I just check the levels. Because it's an aromatase inhibitor and it knocks those estradiol levels down immediately, whereas tamoxifen blocks the effects of estradiol at the level of the receptor on the cell. So it's a little bit different. I can use anastrozole and modify the dosages of circulating estradiol, and by virtue of how much anastrozole you're taking, just by checking labs. It's very, very simple for me. I usually just keep men's their estradiol levels at around 20 by just changing their dosage of Arimidex, and they tend to do well at that level.
Yeah, this is such gold. Okay, Scott, continue.
All right. Do you foresee a time in the near future that it'll be easier to have access to HGH for anti-aging patients? A lot of guys are driven to black market HGH and run the risk of getting scammed by unscrupulous shysters. What is your thought on the use of God, I don't know the word for the increasing for the increasing HGH?
Leonard, you want to comment?
Sure. Well, so one, I never, ever advocate going to the black market, okay? That being said, I understand the real world, and people do, but the message I would have to say is be wary. You don't ever know what you're getting on the black market, and that is the danger. The danger is not getting something. The danger is you don't know what you're putting into your body. So that being said, there is a role for growth hormone, and as we're aging, we rely on the effects of growth hormone to basically have all of our cells and metabolic functions working optimally. Most insurances don't cover growth hormone, so it can be quite expensive for patients. The way to go about it is really to see a physician, somebody who's certified, somebody who knows, such as Dr. Osborn, and I'm not plugging his business, but in a way I am because he is so knowledgeable. One of the, I guess, mechanisms to determine if you would benefit from growth hormone, although I think most people over 40 would, is by doing a glucagon stimulation test, and that is really an actual physical test that can be done to determine whether or not you would directly benefit from growth hormone. That's a way in which a lot of the insurance companies will validate the need for growth hormone. If you are going to one of those anti-aging doc-in-the-boxes, they won't even run that by you. So you should learn as a patient to ask for these things, to understand what you're getting into, and to really make sure your doctor knows. If you ask your doctor about any of these things we're discussing and they don't know what it is, or they just
another doctor.
Yeah, wrong doctor for you. You know, wrong doctor for you. So, you know, the basic premise is go to somebody who's knowledgeable, who has a scientific background and interest in these things, and is not just doing it for the anti-aging process or the look. You know, I really loved, again, Brett's description of his appearance is a side effect of what he's doing. I'm not so sure that's my case. I think I, in a way, really put how I want to look as one of my goals. It clearly is a side effect of proper nutrition, diet, supplementation, and exercise, but I put that up there. I think for me that's an important aspect. So whatever your goal, whatever your reason, you cannot take the medicine part out of it when it comes to growth hormone.
Scott, you want to ask a couple more questions, or Dr. Osborn, did you want to add anything to that?
No, I think that's everything that was said was sort of expressed my my sentiments in the context of growth hormone. You know, Scott had asked real quickly about the use of pro-hormones, and there are pro-hormones that are out there, such as sermorelin, which is a peptide. It's actually it's growth hormone releasing hormone, sort of a shortened version of it, if you will, that stimulates the release of growth hormone. So if you want to use your body's natural what's called hypothalamic pituitary axis in order to stimulate growth hormone production, you can go a more natural route. It's not going to obviously drive your IGF-1 levels. IGF-1 is a metabolic byproduct of growth hormone for those who are unfamiliar. Sermorelin is going to use your body's natural access in order to drive growth hormone up, but it's not going to give you those high levels that you're going to get with exogenous, with injecting the exogenous substance itself, so the growth hormone. It's a lot cheaper, and it works quite well, quite frankly. Again, the goal here is not to turn an individual into a bodybuilder. It's not about turning somebody into Superman. It's not about putting 5 units of growth hormone into your body every single night. Not only is that expensive, but it's stupid. It really is. And sort of, if you go to any of the anti-aging meetings, as Jay and I, as we had discussed previously, Jay, these guys use 0.5 units, 0.75 units a night, not 5 units a night, okay, which is bodybuilder doses. Again, you have to see all of these things, all of these modalities in the context of health. This is not bodybuilding, period.
You guys, we could talk about this for hours.
So yeah, Scott, I know we got to go on. There's some questions that weren't answered, but just I want to
just get always answer them next time. I mean, if these guys are going to be coming back, like I think we should keep doing this.
Would you both consider coming back at another time that's convenient for both of you? I mean, if it's separate, that's fine. But we definitely would love to have you both come on again.
No, I'm just going to say it right now. We want to make this regular where all 4 of us are on the show literally like at least once a month. I know there's so many people, both men and women around the world, that need this kind of information. There's not a lot of transparency, as you guys both know. There's way too much bullshit and not enough, candid, transparent conversation like we're having, and I think this is gold. And if you guys are okay with it, and Scott, obviously you're okay to moderate, I think we should do this once a month going forward.
Yeah, and absolutely. It gives me more time to educate myself so I can sound as prolific as Dr. Osborn. I'm going to go back.
You're both absolutely phenomenal, and honestly, both of you, from the bottom of our hearts, thank you, thank you, thank you.
Totally.
Thank you guys. You
My
guys
pleasure.
are doing a spectacular job getting this and delivering this message, getting it out there, getting all this information out there. It's truly unbelievable what you guys are doing, and the following that you guys have amassed, and it's extremely important. These are extremely important messages, and the key is really building up enough momentum or critical mass, and we really can sort of drive the field forward and push the envelope, and that's sort of the message here.
Awesome.
Yes.
Yeah, just like Dr. Leonard said at the beginning, we're just getting started. We're just getting warmed up.
Being the best you ever. Hey, everybody, have a good holiday season, and we look forward to 2015 being spectacular.
All right. Thanks, everyone. Thanks, Monica and Jay. Great job.
Thank you, guys. Spectacular.
We love you.